Hello, my name is Dr. Victor Katz, and I work at Muddy Branch Veterinary Center. I'm here to talk about FearFree. Many years ago, when I first got into veterinary medicine, FearFree was not available. At that point, we were using brute force to hold on to dogs. Late 1970s, early 1980s, when I first got into this field, my boss would have me hold on to a dog as hard as I could, or as best as I can. And if I wasn't able to do it enough, we'd have two of us, or three of us, or four of us to do that nail trim. All it did was ramp up everything, and the dog got more and more stressed every time the dog came in. Now we have FearFree. We at Muddy Branch Veterinary Center have been FearFree for about a year and a half. It really helps us do much better service, much better medical care for our patients with a lot less stress and a lot less anxiety. FearFree starts with puppies. We have puppies coming in as young dogs, 8, 9, 12 weeks old during their socialization time. We are flooding them with peanut butter, flooding them with Cheese Whiz. If I'm doing a vaccine on a puppy, we're giving the puppy Cheese Whiz while I'm doing the vaccine. That dog's wagging its tail. It has no idea we're even giving the vaccine. When they come back subsequently, they're just all happy, wagging their tails when they come in the door. It's just a joyful experience for them. This is what we're looking for. Some of the older dogs need extra help. With those dogs, we might offer gabapentin or trazodone, which are oral medications we discussed with you about, in order to give the dog the night before, the morning of the appointment. And with these dogs, it is far easier to do things with them. It might bring on a scale of 1 through 10, 1 being easygoing, 10 being really stressed, or bring the 5 4s to a 3 or a 2, bring the 6 7s down to a 5 or a 4. And it really helps us do things with these pets so that they're less stressed, hopefully as time comes in again and again. If we use brute force, those dogs are going to remember it the next time, and they're going to be a lot harder to deal with every time they come in the door. For some of these dogs, the oral medications are not enough. Those dogs we use injectable. We still give the oral medicines the night before, the morning of, before they come in. After that, when they come in the door, with your permission, we're all on the same page, we might give an injection of a medication that helps the dog go to sleep so that we can work with them and do things with them much safer for them, safer for us. The nail trims, look at the ears, whatever we need to do. When we are done, give them another injection, they wake up, they're walking out the door within 10 minutes like we haven't done anything. And it works great because as time goes on, a lot of these dogs are less stressed in the future. I had this one case a while ago. This dog came in with a nasty ear infection. The owner had a cage muzzle on the dog. I looked at the dog from a distance away. We stopped the appointment. I gave him the trazodone and gabapentin. They came back the next day. The dog was still growling at me, but I was able to work with the pet by myself without any help. That really helped a lot. Now that dog's come in several times, and each time it comes in, it's less and less anxious. FearFree has really helped us do much better veterinary medicine with a lot less stress and anxiety. It's a win-win situation for everybody.